So we're live in Ave Maria, Florida. This is Dr. Raul Enad. Today we're going to talk about regenerative medicine. What are stem cells? What are exosomes? What are PRP? I'm sure you have heard a little bit of this now lately, but not all, even the medical professional, even the healthcare are still asking, what is PRP? What is exosome? What is peroxisome? Now, exosome. What is stem cell? Briefly, we talk about stem cell that can be derived. Mary is not here, so I think I have to review it for the sake of the sorrowful passion of Mary. Mary, you like me to review the stem cell?
Yes.
Yes.
I'm always.
Yeah, it's okay, no?
Yes.
So the stem cell can be harvested. The most not liked, and in the state of Florida, it is prohibited to harvest a stem cell from the embryonic stem cell. So what is embryonic stem cell? If you read basic science, embryo, when the sperm and the ovum meets in the ovary or in the uterus, somewhere it unites and forms into a cell. That's the beginning of life. You cannot doubt that. Even if the other side would say, yes, it came somewhere, but no, you have to go back. It united from the ovum and the sperm. That's the first cell. And then it divides into two. That becomes a two cell. The two cell becomes four. The four cell becomes eight. The eight cell becomes 16 cell. That is the lining of the blastocyst, the stage, which is about 2 days to 4 days. And that is the stem cell that's being scraped. Those cells will develop to every little tissue that you have in your body, from hair to nails to everything. So that becomes a problem because if you put a stem cell in your body, it can proliferate in many different cells. If you put the stem cell, for example, in the shoulder from embryonic stem cell, then that's a problem because it cannot just be stem cell by property. Is that if you have a bone in the petri dish, you puts the stem cell beside the bone, that stem cell will grow into a bone. Again, if another tissue would be, if this is a petri dish, this is a liver. If you put a stem cell beside the liver, that stem cell will become a liver tissue that can be used for transplant eventually. Or if it was a heart muscle, you have seen videos in YouTube where a petri dish, this stem cell, if you put near the heart cell, it will become a beating heart. That's stem cell. But not the question is, where do you get the stem cell? Beware, in state of Florida, it is not allowed because in state of Florida, the law respects life. They don't allow embryonic stem cell or stem cell coming from abortive tissue or umbilical cord coming from aborted babies. In the state of Florida, umbilical cord can be used as a source of stem cell. The stem cell has to be taken from after delivery. In a company that I attended to where they had the stem cell conference, they actually use only babies from cesarean section. Why is this important? Because at least in the cesarean section is controlled, there's a medical facility involved. That means the donation is sterile. If you get it umbilical cord from somewhere, like a tube that was given to you, this is an umbilical cord from somewhere. You have to ask, where is it coming from? Was it it was a vaginal delivery? Could it be a umbilical cord after induced abortion? That's a horrific story that you can hear. Or could it be from a deer or whatever? It says umbilical cord. You don't know. So be careful of where you get the source. I took 2 Viagra tablets. My legs are paining. Thank you, Mr. Hard Worker. God bless you. Here in Florida, we respect life. So he's just making a joke. He's a jokester. So the stem cell is very important. The source of stem cell is very important. So we travel on. There's another source of a stem cell called the induced pluripotent cell, which is not quite clinically used at this point because there are many other sources. This came from the work of Yamanaka, a Japanese scientist who pondered one time in the microscope. He has a daughter, maybe two or three, I don't know. He's Japanese. I don't know his religion, but it's in the news, in the web, on how he discovered it. He pondered on the cells of the embryonic stem cell coming from the from the embryo, because that's what they were working on at that time. He said, I will never touch this embryo because this is the same cell that will grow into an embryo that will stand up eventually like my daughters. So he invented the IPS, induced pluripotent stem cell. How did he do it? He harvested the fibroblast from the skin and I think another cell and put some factors. These scientists are so brilliant. And then eventually it had the property of these adult stem cell that is capable of regenerating. Where else can you get your stem cell? In my training with A4M, we harvest cell from the adipose tissue. This quite is an interesting source because not only that, you put a mini liposuction in your belly or somewhere, but then eventually it becomes a big liposuction because people want to get the fat. I'm not using it because it's tedious. But for the sake of taking the stem cell, you can harvest that and make stem cell from the adipose tissue. The most that I prefer using is the bone marrow aspirate. You put about bone marrow and then you aspirate the blood from the pelvic bone, and it's very tolerable, and it's quite acceptable because it's an adult stem cell. It has the property that can safely proliferate into the stem cell that you like, for example, the bone, the liver, the heart. Then the question is the delivery. How do you deliver that stem cell proximal to the damaged tissue? So beware of also of this propaganda, because in that conference, an anecdote was also shared to us. Reportedly, there was a doctor from California, no license. Oh, not even a doctor. I'm not so sure about the details, but this is how crazy it can get with stem cell. That somebody came to Florida in West Palm area, rented our B&B, not a clinic, not a medical clinic, and had somebody to be a front as a licensed practitioner. He charged $50,000 each and had 100 almost people, count the math, for the promise of curing Parkinson's or Alzheimer's. That's how people become so desperate to get a stem cell. And then they go to other countries, Panama, other the Caribbeans, but there's a proper way of doing it. State of Florida and Cadenza Medical Clinic can give you stem cell therapy, but it has to be the proper harvesting, the proper source, and the proper indication of stem cell. In the state of Florida, there are only two practitioners that are allowed to practice, MD and DO. Not OD, not DO, only DO and MD, not DM, whatever it is. Only two, MD. And there are only three indications that the state of Florida is allowing you to treat. If there's any advertisement of treatment of this and this and that, that's illegal in Florida. It could be, in theory, be an advantage or an added layer, which we can talk later. But there's only three. Orthopedic indication, meaning joints, shoulder, tendinitis, knee problem, ankle problem. Second would be wound healing, which I also was able to give a PRP on a patient with wound healing, and pain. Those are the indications. Now, these three indications have been proven to be treated by not even stem cell. Stem cell can do it, but let's dissect again what is the indication for stem cell. Before we go that, let's go to the first part. The usual most common is PRP, platelet-rich plasma, which I have successfully been using here, and many are witnesses to this. It is a very simple procedure, relatively economical compared to the $1,500 that people get treatment or get asked to pay in some other big cities. The reason why PRP is effective is because in the platelet, the small platelets. That's why it's also important to harvest and process the PRP effectively in a clean way, in an air clean environment, sterile environment, um, so that there will be less contamination. Um, the PRP has a lot of factors. For example, platelet growth factors. That's why in theory, it can grow hair. I'm past that bedtime for hair. There's some limits to treatment also. Believe me, I tried it, but it didn't work. With microneedling, with PRP. Some they inject it, but they have actually a better technique. I'm not interested because my girls and my ladies in the house said, "You're fine with what you what you have, and it's easier to manage. You just blade. Forget it." So the other one is an expensive. So the PRP also has an anti-inflammatory effect. That is the reason why it improves pain. And I keep on telling other people, other colleagues, that the why my patients report immediate relief. There are other many reasons. It could be anti-inflammatory, but maybe it's not the anti-inflammatory that gives you immediate effect. For example, when you have frozen shoulder, or technically, diagnostically, it's called adhesive capsulitis. The capsule of the shoulder becomes adhesive. They're scarred. You cannot raise it, your arm. It's frozen. So that the joint there is so tight. That's why when you give PRP, you increase the volume, you improve the space between the tight joint. That's why you get relief. But eventually they report continued improvement. The same with the knee. My very good friend, Father Leandro, probably he would probably raise his hands and yeah, I have it. We run together from time to time. I run faster than him, on the record, Father Leandro. No, he runs faster than me. But when I injected his knee because he was complaining of knee pain, he was so impressed. He was able to genuflect without problem. And so he got another injection before he went left us in Ave and went to somewhere for a retreat, no, for a pilgrimage. And many more. Another case, for example, recently, and is willing to give a testimony. He is about 50 some years old, maybe, and he was complaining of chronic pain in the neck. The diagnosis, the impression of the other doctor in Naples, was that he has a disc problem that needs to be cleaned. So he has to undergo surgery, and he has to be scraped there to clean the disc. I'm not a surgeon, but I understand a little bit. So when I examine it, remember the pain in that area can be very complex. It could be neuropathy from what do you call this, compression neuropathy, when the nerves passes through the disc, and it will compress the nerve, and it will give you a neuropathic pain. It will give you numbness, pain also in the area. It could be the muscle around the area because it's stiff. It could be the ligaments. It could be the fascia. So you have to explore and think like a doctor that you're supposed to be trained about. So when he came in over here, I did my exam, the usual exam, nothing special. I'm not a special doctor. So I palpated the tender point, what you call trigger point. I identified two. So I offered, we can do PRP in these both sites. Sure enough, thank God, I didn't go to my appointment because he was supposed to be scheduled for surgery. And he said it healed with a PRP after about a day or two or something. And then he came back. I think he scheduled for another injection, didn't he? Or the second, or I'm not so sure. I forgot. The one with the hair.
Father Leandro.
No, the other one. This was another one.
Mr. Police
Oops. So yeah, they have confidential. So it would be. So he did second, I think.
Yes.
Second. The other one was the most common cause is gluteus. Don't raise your hands. The buttocks. Many, especially women, but it's not just women. In fact, my latest patient for the bursitis of the buttocks is a man. So there's the inflammation of the bursa where the muscles converge and it creates a space called bursa. So when you have moments like in stable gait, like your balance is off, it compensates on the other side, and that gives you more contraction, and that space becomes inflamed and gives you pain. A lot of times, before regenerative medicine, we would give steroid and lidocaine. It relieves because there's lidocaine. However, we realize now that lidocaine is more inflammatory and steroid is anti-inflammatory, but it weakens the tissue. So that's not a good choice. It seems like PRP is the best, and thank goodness we can still make a living out of PRP. It's your own blood. We process it with the help of my knowledge in medicine. Then we can apply this. So it had been successful to patients. In fact, this kind of pathology, bursitis, only required one injection, if I remember, and it gives immediate relief. So what else is there? So the highlight of the story there was that the CEO of Zeo Scientific, a billionaire, himself, um, the was a beneficiary of some of the regenerative medicine. This time, exosome was used. So let's talk about exosomes. Exosomes was not much in the horizon when I was doing in 2016 when I was taking the board certification for regenerative medicine. Exosomes are tiny membrane-bound particles. It's not alive. It's um, it's a protein, extracellular vesicles released by most all cells of the body. The heart muscle, everything muscle. They carry proteins, lipids, RNA, and other molecules that allow cells to communicate with each another. It's just like ET, signaling among each other. So if you're inflamed, the exosome would say, "Let me help you. I'll heal you." So that's exactly what it is. That is the reason why. One example was that the case study of another doctor who presented. He's from New York. Injected a exosome in here. Um, and it matters also the report that the amount of exosomes injected here, and it improved. And it had also some added benefits that I'm going to discuss later, not here. Remind me. Another one, the CEO also had a chest pain. This particular patient was very interesting. Had a chest pain, and the lesson is if you have chest pain and you still have chest pain, despite the doctor saying you go home, you have nothing, enzymes are normal, EKG is normal, you go home. He knew that something was wrong. He was attempted to be discharged 3 times, and they decided to keep him. Well, in the middle of just as he arrived on the floor, medical floor, his heart was noted by monitor to have stopped. He was resuscitated and all those um, emergency crash carts, we call it. Turns out it was actually a two couple of arteries, blocked artery. The other one, the LAD, was also severely blocked. But they said we cannot do it now, but then eventually later. Well, he woke up during that admission that with all the people with scrubs and ready for surgery, because turns out allegedly, reportedly, his LAD, the main artery, was injured during the procedure. So he was induced a what do you call this, a heart attack, because when you sever the artery, essentially there's no blood supply to the muscle, so essentially he developed a heart attack. Well, um, that heart attack caused his heart to be damaged by 85%, such that only 15% was functioning, just like this. So he had to go through that in the hospital that he funded in Florida. So money doesn't buy much. It's only the will of God. And I think he mentioned something that he had some kind of conversion story, but that's irrelevant right now at this point. Moving forward, he took notice, he read about exosome. So he read, he's a brilliant man, he's a lawyer. And he took treatment 1 week, every week for, I think, every week for 6 months or something. This might be his maintenance right now, but he got a treatment for exosomes. Now from 15%. His heart, his function is now 60%, able to play tennis at his age, like he's 70 years old. So those are the wonders of regenerative medicine. From stem cell, ideally, this would have been a stem cell, but how do you deliver the stem cell to the heart? You have to have a catheter, and then making sure that the stem cell is put directly to the heart or in the lung, for example. It's very fascinating. But the exosome seems to be working because it acts by signaling. Hey, you are damaged. I will fix you. But it needs a lot of investment because exosome um, is harvested with a kit. You get a kit if you want those. Um, it's already expensive to start with a kit, and you send it to the laboratory in Fort Lauderdale, and then they bring it back to inject for you as an exosome. So those are the new horizon of regenerative medicine. Many things that can be done, but you have to investigate properly, make sure you're not fooling the patient, be transparent of what's happening, what's indicated and what's not. Make sure the stem cell is not sourced from an aborted fetus. Making sure that the only three indication for pain, for joint orthopedics, and also wound healing. So it is exciting moment. The good thing is in Florida, they allow these science to prosper. July 25, they put into law that stem cell therapy can be used in Florida, even if the FDA has indications of not doing it. In the state of Florida, you can do some indications, and that's the three: orthopedic, wound healing, and pain control. One of the conditions that it cannot be from an aborted fetus. It has to be from the afterbirth afterbirth capture, or what do you call harvest. Umbilical cord, amniotic fluid, name it. Exosome, you don't need the birth. You just need to process it on certain ways. So what are the therapeutic applications of exosomes? So researchers are investigating whether exosomes can be used to deliver drugs, genes, other therapeutic molecules. It's just beginning. Some studies are exploring exosomes derived from stem cell for tissue repair and immune modulation, which we are happening and witnessing now. So remember, exosomes can be harvested, found in the blood, in the urine, and it contains biomarkers. So it is a very dynamic type of cell. The current treatment in as of 2026 is not approved. Exosome is not generally approved. Hi, Michael.
Hey.
Not approved by the US FDA for routine diseases. So forget about asking exosome for the treatment of Lyme or chronic fatigue or post whatever, but only for pain, for orthopedic, and what do you call this? What did I say? Wound healing. But despite all these things are happening. The physicians are witnessing healing potential of exosomes other than the three indications. So that will be exciting in the next few years, for months, when it will be reviewed that why not just on these three? Why can't we just do it more? As more MDs and DOs hopefully are practicing and documenting all these things. It's tough because you cannot document, because you cannot give it. So God will provide. So muscular cell injury, wound healing, and also pain. Beware of somebody giving you the lure of what do you call this? Potential relief from neurologic disease, heart disease, autoimmune, and certain cancers, because that's against the law of Florida. But we'll discuss more, and you'll understand why I'm not discussing it here. So I'm proud to say that I did board certify in functional and regenerative medicine, and that regenerative part, which I took in 2016, is stem cell, and PRP and exosomes. So if you are curious about certain indications and treatment, I can share with you PRP had been so successful um, for orthopedic, for joint problems, for bursitis, fasciitis, tendinitis. I have a lawyer from Valparaiso who was afraid of needles. I can never forget him. I guess, what do you have? I said, what do you have for tennis elbow? I said, PRP. I said, what is PRP? Explain further. What does it intake? I'll draw blood and then right immediately. He said, no, 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 I don't like needles. No, no, sit down because he's my friend. Sit down. Draw blood, 3, boom. Make long story short, I injected him. The moment he went out from the clinic, he already felt some relief. And that's the reason why my experience is quite different from what in the general literature would describe. He vouched, can I tell people? I said, sure. It's a common phenomenon that you can benefit from this. So in conclusion, stem cell is here in Florida. It comes in different shape. Don't use abortive fetus. Don't use umbilical cord from unknown source because it has to be compatible with your tissue, with your system. It has only to be the post-delivery tissue, after delivery, not even post-delivery. But there's some specific facility that only use cesarean section source of umbilical cord. Exosome is there. It's a new product in the regenerative medicine, relatively. And of course, PRP. There's another one called PPX, ultracentrifuge serum, where they can precipitate the platelets into a high count platelet serum. And that also had been reported to give you the benefit, which I'm going to explain later. That concludes my talk, and I will entertain some questions at this point in the audience live.
Back several years, there was people like, when they would have the babies, they cut their umbilical cords and send it to some bank.
Yes, it is still available.
I mean, okay.
So the umbilical cord is very, very interesting because from what I understand, the umbilical cord has to be compatible with the HLA, histocompatibility tissue. It benefits well, simply. For example, if there's a baby, your baby, it's delivered to the bank. That stem cell from the umbilical cord might help you. For example, this woman who had you developed leukemia, and that became the therapy for the leukemia and saved her life. So, but umbilical cord from other people, it's a push. Yes, compatibility studies that needs to be addressed. Yeah, but for stem cell, for example, orthopedic, you don't need stem cell for every orthopedic. It usually benefits the tear because it needs to increase to regenerate the broken tissue. But if it's just degenerative joint disease or osteoarthritis, PRP can work. Yeah, it does work with a PRP in the knee. Do you have any?
Exosomes are a big mystery here.
Yeah.
Okay, first of all, you said it's found in the blood and urine.
Mm-hmm.
How do they extract it? Second question is,
Mm-hmm.
how do they deliver it? Like your doctor, how did they deliver
Deliver the exosome. So the first question was, how do you harvest the exosome? So they have a special processing, centrifuge, collect the blood, and like getting PRP, and then the PRP is also, they have a specialized lab, which cannot be done in a clinic. So exosome has to be at the base expense already. And then you're talking about maybe, depending on the volume, maybe 1,000 and that, but I can discuss it later. How do you deliver? For example, if you have a pain in the shoulder, you inject the exosome directly, but not too hard. But it's supposed to travel theoretically to other injured tissue. That's why some other things need to be discussed. Anything else, Mary?
No, it's fascinating how the growth.
Yes. And 2016 was when I studied this, and then now I'm able to apply. This was 10 years. Yes, Leah.
Yeah, so with exosomes, there's a delay then. It has to be sent to the lab and come back, right?
Oh, there are exosomes already that already been processed that can be used. Um, but if you that's another story is a PPX. It's a plate PRP, but ultracentrifuge is just a kit. It's still yours. Exosome can be from somebody else. So the PPX is your blood processed and sent back to you, but the exosome can be from somebody else.
Should not be matching or something.
There's in theory there's no need for matching because it is not a cell. It's a protein. But that remains to be really. They have experienced. Many doctors have experienced so much.
What's the difference between PPX and PRP?
So PRP is what we process here.
Right.
Spin it 3 times. No, spin once to remove the red blood cell, and the plasma is spun again to precipitate the platelets, and then you separate the platelet rich and the platelet poor. And remind me about another thing on this one, Ruby.
With all the current research and the positive outcomes that are a result of these interventions,
Mhm.
is there a chance that the FDA will,
I think there's a good chance because now there are many doctors that are interested. In that session, there were like 100 more physicians. Imagine the whole state of Florida. There are a lot of subsets. I met a guy from Miami who opened up a practice there nearby here. So I would not be surprised there will be another doctor who would open some shops here in Ave Maria. And that would be exciting.
It's a shop.
Doing the same thing you do?
I mean, a clinic. It could be. Yeah.
They would let another doctor in
Here?
doing the same thing you're doing?
I mean, I think it's a fair thing that another doctor, if knocking at the door and there's a space, they should be allowed to do it.
Oh,
I went through that, and I felt bad that I cannot come in because of something, but turns out no, anybody can.
Shouldn't they be certified first before practicing?
So there's no board certification that they're asking, only a licensed MD and DO. But I'm proud to say that I went through board certification from the A4M. You can learn how to inject and learn a little bit of exosomes. You're allowed to practice that, but you have to know more about stem cell, its indication, and all those stuff. Yes, Ruby.
I spoke to a traditional rheumatologist and I mentioned stem cell therapy on regenerative medicine.
Hmm.
But then they poo-poo it because they said, well, it's not FDA approved
Exactly.
and it's not, whatever reason they have
Hmm.
based on their training.
Right.
So how is it that we can change doctors' minds so that way we can afford it with insurance?
Right. Number one would be
practice?
that more doctor qualified should study.
Yeah.
Number two, in the state of Florida, that's good because they're allowing it. Number three, more chance to practice it, and more patients should avail of it so that they can convince the doctors that it's working. So with that, I think we can stop, and then we can talk on a side bit, other things. So for now, out there in the web, I will say goodbye, and we'll see you the next time. Goodbye.